Hello and welcome to Dr. G at the Heart of Healthcare and happy Death Doula World Training Day. I have the president of NEDA, Ashley Johnson, here with me today, and we are excited to just talk about everything death doula slash end of life doula, and help people understand. Hello, Ashley.
Hey there. Thank you so much for creating a space to talk about all things end of life and death doulas.
Oh, it's my pleasure. I'm preaching to the choir with you, but so many people are afraid to address end of life issues and end of life concerns. So the mission here is to help them navigate and plan ahead. We're coming off the heels of National Healthcare Decisions Day, and I know you were part of the NHPCO Interdisciplinary Conference. And so we're just gonna help people get comfortable. So welcome.
Yeah, thank you.
Yeah, so first of all, I am just I have so much that I'm excited to ask you about. Um, where do I even start? Like, first of all, people, you need to go watch the TED Talk. You need to go learn about the organization Loyal Hands and learn about NEDA because you need a death doula. You might need one, right? I like that
Yes,
whole
I
thing.
like it. I love it.
So tell me, let's just start there. Some people, I have been in circles like with physicians and brought up death doula, end of life doula, and someone literally said to me, "Ooh, I don't like the way that sounds. Death doula, what is that?" Tell us the difference. Like some people say end of life doula, some people say death doula. Just let's start breaking this down. What's the difference? Is there a difference? What's the training? Let's just talk about
Yeah,
that.
let's go ahead and start about that's a great question to go ahead and start off with. So the term end of life doula, death doula, doula till a dying, it's interchangeable. It's kind of like how you would say mom, mother, mom. It pretty much is the same thing, but it's the preference of the individual that prefers to use it. And when we're saying, I usually tend to say end of life doula, shock value. Yes, I am a death doula, and let's start this conversation, right? And so when people say, what is an end of life doula? I lean on saying, we are a compassionate group of individuals who offer that emotional, spiritual, practical support to
Mhm.
individuals and their families during the whole dying process. We're providing that comfort, that guidance, that advocacy to ensure that folks, their wishes, and their values, their preferences, that they're honored and that their journey is as peaceful as we possibly can make it.
That is beautiful because we need that peace, and we're here to provide
Mhm.
peace of mind and healthcare. Awesome. So, how did you come into death care? Just in the beginning of their journey, when did you learn that this was something you had an affinity to
Right.
in
I'm
your life?
gonna definitely give you the secret of it found me. And I say that because as a child,
Mm,
I
yep.
would read the obituaries with my grandmother. Instead of the Sunday comics, we would read the obituaries. And I had a fondness for them. I grew to love them because you find out a lot about people reading their obituaries, their legacies, their life, the love of their family, right? Or the not so much great things where it's short, sweet, and concise, right? He lived and he was grumpy. The end. Right? And it's like, oh, okay. Now you become intrigued. You become really invested into learning about people and their legacies that they're leaving. As time
Wow.
progressed, I went on to college, University of Florida, and really dove into my aspects of learning about people, humans. Studied anthropology with my background in chemistry, and because I really wanted to immerse myself with different cultures and see how I could put their stories together. I did a bit of whole body donation, and that's where I found out there was a gap in between people processing that they were dying and then how their families were being comforted with being that liaison with funeral homes. So from there, it was my childhood friend that really pivoted my direction to be where I am today, because she was diagnosed with stage 4 colon cancer at the age of 27. And with my what at that time with my collective um, years of experience and resources, what I thought I was doing is just being a friend and
Mhm.
just using what I, right now, what I would call my toolkit of resources and folks. It actually was essentially my doula toolkit.
Wow.
So when we were having these private conversations of talking about end of life, do you want to freeze your eggs? Like these questions where sometimes you really never ask your friends those types of questions. What do you want to happen if the treatment doesn't go according to plan? What do you want to do? And from there, we were able to honor her wishes, her values, her preferences, have these open conversations of picking out her pictures that she wanted to be in her obituary and things of that nature. And after she transitioned, it was actually her family that would refer me out to people. They would just say, hey, Ashley knows this doctor. You need to connect with her. Oh, you're sick. She knows this doctor. Oh, did somebody just pass away? She knows this clinician, this funeral home, this grief support group. Connect with Ashley. And it really just blossomed from there.
It's so for us who know that this found us, it is so intuitive, right?
Right.
And I just heard a lot of parallels in your story, like from me, the co-author of my book, The Real Deal about Hospice. She's an end of life doula. She talked about her grandmother and how that affected her. I know, in my family, a lot of funerals growing up, and I remember thinking in high school, okay, maybe I'll be a mortician,
Mhm.
and I always used to watch that show with the coroner and all that stuff, just into
Right.
it, and wanting to hold space for people. And that's what it boils down to. When you find yourself in that space that you can hold space for people who are in these terrible situations, terrible for them. For us, it's we're here to help, we're here to make it peaceful. But that's just so awesome. You say to someone who I know there's a lot of folks that are like maybe coming out of nursing and doing it, or some people coming in and switching careers. What would you say to folks who are wanting to take the first step in getting into it? Like what should someone do if they want to become an end of life doula, death doula? What's their first stop?
I would first say listen to the calling, right? Because again, you want to walk into this space authentically. Uh, and I say that is because it is a labor of love. And then from there is to learn as much as you possibly can. The world is ever so changing. There's so much that's going on within these spaces and it comes to end of life. I would always pride myself with saying I'm a constant student. I love learning. Um, Something that I take a doula training course, one training course a year, because again, there's certain things that what is it? The phrase you pick the meat, leave the bones, right? And whatever resonates within me that I can add to my now doula toolkit to help the communities that I serve. So if someone says to me, Ashley, I have been feeling the urge to get out there and be an end of life doula, first, I'm going to direct them to our website. Of course, I want them to get all of the information. And at National End of Life Doula Alliance, one of our purposes is to be that credible source for end of life doula knowledge. So I'm going to say, here's our website, learn the information about end of life doula, their scope of practice, the guidelines, the ethical and practical guidelines. And then two, I'm going to say, you don't have to, but I would encourage you to enroll in some training programs. Again, it is something that you can put in your doula toolkit. It can be something related to ritual or something with culture. Again, working with end of life, you will be crossing paths with different cultures, and to be aware of that and to acknowledge your own bias is only going to help the communities that you're serving. It could be vigils or advanced care planning, because there's a variety of end of life doula training courses. So again, I'm going to say listen to that calling and then immerse yourself into this world. So because it's open, and we're oftentimes like this space is open and just filled with love, to where we want to help each other thrive. So,
That's wonderful. That's wonderful. And so I just have to give a shout out to some of the end of life doulas, death doulas that, come across my socials because, we interact out there. I know Death Doula Casey, she has a new
mhm,
school that she has, and she has an RN background. So there'll be some tools there,
yeah,
to help folks, because even though this is a non-clinical role, I think, knowing a little bit of that piece to put in your toolkit is really good. We have Serenity End of Life Doula, she has her training. Sharon Harris, she's an LVN and her years of experience. And, you can get a little bit of hospice learning from our book. And again, there's so many folks out there that's doing this work. Oh, let me not forget Gabby out there with all her books.
yeah,
And so there's just so much that people can learn and support the end of life, because there's no shortage of needing help with
right.
that.
There
Yeah,
was once a
yeah.
statistic that there is 10,000 people each day in the United States turning 65. When you think in that metric, it is like we need folks to help folks, is bringing it all the way back to humanity. So, yes, training courses, educational courses, I think are essential. It is not mandatory, but again, I am a student. I love learning. I love immersing myself into that. At NEDA, we have roughly 70 training organizations that are a part of our organization. And I oftentimes encourage folks that are interested in going into exploring more education to reach out to those training organizations on the NEDA website. Reach out to them, seeing if you could view their curriculum or see their scope of practice, just to make sure that it's aligned with you. I want to empower you into the decision that you're making for education, just how you would look at when you're going to college, and you'll look at and see if they have your major and if it aligns with you. I encourage you to do that when you're talking about becoming an end of life doula.
Yeah, fantastic. I first learned about this discipline, and I'm going to call it a discipline because it's important to supplement the interdisciplinary teamwork that we do at the end of life. I learned about it on End of Life University with Dr. Karen Wyatt
Hmm.
about 5 years ago, and I listened to that podcast, and it was like, wow, I didn't know the world was so vast, even though, again, I had become a hospice physician. I was in the world working. There was still so much to learn. So I just encourage, all of you to follow the links here, and I will put a link to the NEDA website in the show notes. I want to touch on the other side of it, because we're here to educate and empower people, right? So
Yes.
I wanna touch on, I heard a criticism of the death doula movement, end of life doula movement, from a healthcare provider. Kind of, I don't have a quote per se, but it was
Hmm.
kind of along the lines of like, what's going on? This is getting out of control. It's there's no standardization. There's, what's up? And
Right.
so just could you kind of address that criticism? Because I'm sure you already know about it as the leader.
Yeah.
Just kind of
Well,
enlighten everyone here.
for sure. And I hear them. I hear not necessarily the person that you are referencing, but I understand their point of view. And at National End of Life Doula Alliance, that is for our organization to establish the ethical and practical guidelines for the roles of an end of life doula. Like I said earlier, we have a scope of practice. We are that centralized source for end of life doula knowledge. So although there isn't any national mandated standardization for an end of life doula, we have taken the initiative to go ahead and be that voice to say, this is what we expect end of life doulas to show up as when they come to your homes, when they show up at your hospices. And we make these guidelines. And again, working with hospices and working with families to make sure that everyone knows that we're here to just to complement the services when it comes to end of life. There's so many avenues, there's so many moving parts when it's coming to end of life. And those who know, which we'll all get there eventually, is to really have that full comprehensive care, right? It's the duality, it's the clinical aspect, and then that holistic aspect. Yes, with medication to keep me calm and in that aspect, but also that to feel supported from my fellow human,
Yeah.
that I
Yeah.
can feel at peace, comfort, support as I move along the next aspect of this journey. So we end of life doulas, we're not coming to impede on anybody else's discipline. That's what a lot of it's like, what are they doing? No, we're not
Mhm.
here to impede. We're actually here to be in community with each other.
Yeah. That's good, because there was similar criticism for birth doulas,
Mhm.
right? And I was a part of advocacy with the March of Dimes just because, of our public health crisis. We just, Black maternal health crisis, and infant mortality. And so again, defining the role is what they want to know, because the OBGYN has a role and responsibility and
Right.
liability for the life of the mother and the child, and so that needed to be defined, and so that's embraced more,
Mhm.
and so that's good to know. So it's great to be a part of this movement. Now I heard about another organization, the International End of Life Doula Association. Is that also connected to NEDA, or is that something separate?
Oh, that is a great question. We actually just had a webinar with them, and it's great that you asked that question. So, ANELDA, they are actually members of NEDA. ANELDA is a training
Oh,
organization, and they are members of NEDA. They are training. We are a members organization. So, again, we are still within community for with each other and complement each other. So great question that you asked that.
yeah, yeah, good. And then, I'm always going to bring it back home because, I'm passionate about hospice care. And I know a lot of agencies are trying to bridge gaps in care, to bridge gaps, in communities that are underserved, Black Americans, Latino communities and things of that nature. They may have staffing issues, and the end of life doula slash death doula may be able to fill in some of those gaps, in care when they're not able to provide it, because people don't get it. Let me explain real quick before we get to the actual question. For hospice care, it's care at home for someone with a terminal illness. However, we're not there all day. Some people, I've seen comments online in these groups are like, hospice doesn't do anything. And I'm like, someone didn't educate them on how it works.
Mhm.
You may or may not see the hospice physician, if that particular hospice agency doesn't set up, an admission visit or something like that, or you're not supposed to be recertified. You will see your RN case manager. You'll see maybe, an LVN who helps, and they work as a team. You may or may not accept the hospice aide who provides that, other support, the ADL care. You have the chaplain, you have the social worker, but we're not just sitting there unless you're on continuous care, which again is crisis care, and that just lasts for a short period of time, and then that's it. The caregiver is responsible for the custodial care of the patient, unless you go to a hospice home or something like that. So people don't really get that. And so I just wanted to clarify that and then ask you, how best could hospice agencies in the United States work in this movement with the death doulas and end of life doulas and making you all a part of the hospice agency? So let's dig into that. And that's how we're going to wrap up today.
Yeah, well, you know what? First and foremost, I wanted to thank you for providing that clarity and taking space to provide that clarity of how hospice actually works within the home setting, right? A lot of people have this miscommunication of hospice, and I'm so happy that you were able to share that. When it comes to end of life doulas, we definitely play a vital role with working with hospice care to provide that additional support and that companionship aspect that you just shared to individuals and their families when we're talking about end of life, whether that be the emotional support or the companionship. We have the advocacy or education and guidance because, like you also just shared, a lot of people do not know the steps of the dying process, which then it provides a very big barrier and challenge when the dying process starts to be shown, right? So lack of eating. Like now, and the family is worried that their family member is not eating. But if they were properly educated, they know that, hey, what steps we're in when we're approaching death and dying. So it's coming in to provide that holistic support to not only address, the needs of the individuals, but also the spiritual, emotional, the psychosocial well-being of them as well. So when I think of end of life doulas with hospice, it's just to complement the therapies that hospice is already doing. That's why I said earlier, it's that comprehensive support that an end of life doula does. And what you hinted at in the beginning was the workforce shortage. So there's a lot going around with there's workforce shortage. With that, it becomes a lot of employees becoming disgruntled because now they're working more hours, they have more patients. And we have been seeing an increase of end of life doulas be integrated into hospice organizations, whether they are doing it under a 1099 or as a W-9 employee. They have been integrated into the system to actually provide doula assistance and under the doula hat and to complement the work of the hospice team. And what they have been shown is that for the ROI aspect of it, there has been a decrease of employees that have been, what is this called? Quitting their current role. There has been an increase of their happiness at their jobs. Also, which that means they provide better services because when you're happy, you give better services and the patients then get that better service. The patient's family sees this service that their family is getting, and now they're wanting to write a review or rave about said hospice care to other individuals that may be in that same situation, which then turns into a referral. So it
That's
becomes,
what they listen to.
yeah, it becomes that circle because again, when you decrease the number of employees quitting, you actually increase the amount of money you save from retraining someone to be in your process. Right? So I don't have to keep training people every 30 days. I keep the same crew for years and they're happy. And our
That's
families and
good.
our communities are happy. So it has been a survey went out, I want to say maybe 3 years ago, showing the integration of end of life doulas and how that reflected in their patient care and their employee morale. And there was an increase in it.
Wow. That's wonderful, and again, listeners, you can go back to a podcast from January about finding the best hospice agency and navigating the Medicare website for their star rating and all that stuff. that is the
Yeah.
quality that we're talking about here, and also staff retention. If a hospice agency is turning people over and the nurses aren't happy and they're quitting, chaplains quitting, red flags. You don't want to do that. But thank you for saying that and breaking that down. What you mentioned about educating the family, it reminded me of a post I saw recently in this hospice group. A lady, I don't know if it was a lady, maybe it was an anonymous post, but this person said that they thought hospice made the person die sooner.
Mm,
And so, when I see that, it's so sad, and they're
right.
like, this for my person, it wasn't fine. And then they listed
Right. They were preaching the
all the
gospel for them.
comorbidities. They said COPD, heart failure. They listed all these things and they thought, no, they were fine. But once they got on hospice, they weren't. And I was like, oh, you
Because
know,
it becomes the gospel for them. That is their experience that they now will share with others, and then other people will hear that and get turned off from hospice. As an end of life doula, I'm there to actually hold your hand and guide you through the process. I've held families' hands to introduce them to their hospice team, right? So the hospice team could get to know the family, and then the family feels comfortable to know that they're more than just a barcode.
yeah.
This they my hospice team, and sometimes it's just been the nursing staff, a chaplain that just come in and created that space, and that space has been 15 minutes, but that made a world of a difference for the family that was going into hospice care.
Hmm, hmm.
So I appreciate you even highlighting to go and look at reviews, right? Because that also provides a sense of comfort. As an end of life doula, that is something that I would encourage and empower families to do. It is your life, it is your death. Let's make sure that you have as much control and say so that you possibly can, right? And you can do that with education. Like let's look at the hospice, let's look at your doctors. Let's start to I want to empower you. What kind of memorial service do you want? What kind of legacy service do you want to leave behind? Because how do you want to be remembered? Not how you think I want to remember you. No, how do you want to be remembered? So yeah.
That's it. That's it. And I think we have covered all the bases. I really appreciate you teaching us about, you trained us today. It's Death Doula World Training Day, but you just trained every one of the listeners about what you all do and the role and gave us a picture of it. I thank you so much for your leadership in NEDA.
Sure.
And, you know, thank you for being on the show. And I'm going to, continue to support you all. We'll work together to make the end of life better for Americans and all over the world, right?
All over the
So,
world. Literally, a lot of our members are around the world. And that's what we're here for, to just promote that education and that support, that there's folks out here to help you with that peaceful transition.
amen. Well, it was so good to chat with you, Ashley, and listeners. We'll see you on the next episode of Dr. G at the Heart of Healthcare. Signing out. Peace.